Hello, everyone. My name is Daisy, and today I'd like to talk to you about sentinel events in a hospital setting. A sentinel event in a hospital is an unexpected occurrence involving death or serious physical or psychological injury. In the healthcare industry, these events are often referred to as never events because they are serious adverse events that are preventable. In other words, it is a major patient safety incident that serves as a warning or wake-up call for the hospital to identify the root cause and implement changes to prevent similar events from happening in the future. Sentinel events can occur in any healthcare settings and can have significant impact on patients, families, healthcare providers, and the organization as a whole. They can also result in legal action, increase insurance premiums, and damage the reputation of the hospital. Some common examples of sentinel events include wrong site, wrong procedure, wrong patient surgery, retained foreign object post-surgery, medication errors resulting in serious harm or death, falls resulting in serious injury or death, suicide, infant abduction, air embolism, and also blood transfusion with the wrong blood type. For sentinel incidents to be avoided, healthcare practitioners must collaborate and communicate effectively, which is key. Multidisciplinary rounds are vital for enhancing interdisciplinary communication and collaboration. It brings together healthcare professionals from several fields, including medicine, nursing, and rehabilitation, to talk about the patient's plan of care. This makes it possible to exchange information, also spot prospective issues or worries, which can help stop sentinel occurrences from happening. In this next slide, it's an example of series of steps that a healthcare facility must take. In the event, is the event anticipated or unanticipated? If anticipated, then there's no need to report. If unanticipated, then you determine whether the event is serious or not serious, and then they must follow guidelines based on the facility's protocols. This next slide is a concept map of a patient that I encountered in our clinical rotation. The patient is diagnosed with chronic obstructive pulmonary disease, or COPD, and possible sentinel events could be acute exacerbation of COPD leading to hospitalization or death, mismanagement of medication leading to adverse drug reactions or overdose, delayed recognition of treatment of pneumonia or other respiratory infections, and also inadequate management of oxygen therapy leading to hypoxia or respiratory failure. This concept map also highlights nursing diagnoses such as impaired gas exchange related to airflow or obstruction or decreased lung compliance, activity intolerance related to shortness of breath and weakness, anxiety related to dyspnea, decreased functional capacity, and fear of death. Also, risk of infection related to impaired immune response and chronic bronchitis is a factor. For interventions, we want to make sure we ensure the patient's receiving enough oxygen to meet their needs using supplemental oxygen. We want to monitor saturation levels and adjust oxygen therapy as needed. We also want to teach the patient effective coughing and breathing, deep breathing techniques, such as pursed lip breathing or use of incentive spirometry. Encourage the patient to engage in regular physical activity and exercise, assess and manage the patient's pain and discomfort, promote healthy lifestyle, prevent infections by teaching patient about importance of hand hygiene, and pneumococcal and flu vaccinations, assess for and manage any signs of infection such as fever, cough, and increased sputum production. So that is the concept map I created for this patient. This next slide shows a picture of 6 patient safety goals. An example would be the National Patient Safety Goals, which is a set of objectives and guidelines for healthcare organizations aimed at improving patient safety and reducing medical errors. These goals are established by the Joint Commission, which is a nonprofit organization that accredits and certifies over 22,000 healthcare organizations and programs in the United States. They are reviewed and updated annually to reflect current challenges and best practices in patient safety. The National Patient Safety Goals focus on helping patients with COPD who have trouble breathing. They want to make sure these patients get the right help quickly, using the right equipment and procedures. The goal also emphasizes the importance of communication and coordination among healthcare providers to ensure that patients receive consistent, high-quality care. And another goal is to reduce the risk of healthcare-associated infections, which we will discuss later on, as well as reducing the risk of patient falls. The next slide shows the National Patient Safety Goal, which is to use medicine safely. We want to record and pass along correct information about patients' medication. Another important factor is to find out what medications the patient is taking. We also want to compare current medications to new prescriptions given to the patient, give the patient written information about medications they need to take, tell the patient it is important to bring their up-to-date list of medicines every time they visit a doctor. So all these factor into our patient safety goal. And patients with COPD often require medication to manage their symptoms and improve their quality of life. So some tips for using medicine safely for patients with COPD is to follow the prescription. Patient may be taking bronchodilators, corticosteroids, mucolytics, antibiotics, and oxygen therapy. So we have to educate them on possible side effects and also to avoid overuse of rescue inhalers such as albuterol, which can actually worsen COPD symptoms in the long run. Patients should be aware of drug interactions, including over-the-counter medications and supplements. We want to educate them to store their medications safely in a cool, dry place and keep out of reach of children. Another important factor is to monitor symptoms and report any changes to their healthcare provider. And lastly, to keep track of their medications they're using by having a calendar or a journal to keep track. The next slide is another example of the National Patient Safety Goal, which is to prevent infection. This goal aims to reduce the risk of healthcare-associated infections, including respiratory infections, which can be particularly problematic for individuals with COPD. This goal emphasizes the importance of infection prevention and control measures such as hand hygiene, use of personal protective equipment, and proper cleaning and disinfection of equipment and surfaces to reduce the risk of transmission of infectious agents in healthcare settings. This next slide shows a possible outcome for a patient that I am using as an example. I will be discussing the importance of preventing urinary tract infections in patients with urinary catheters. Urinary tract infections are common and often preventable type of healthcare-associated infection that can occur in patients with indwelling catheters. The patient the patient I am using as an example was diagnosed with COPD and also has a urinary catheter during the hospital stay. Patients with urinary catheters are at an increased risk for developing healthcare-associated infections because usually they are needed for urinary incontinence or retention. However, the presence of urinary catheter can increase the risk of urinary tract infections by providing a pathway for bacteria to enter the urinary tract. UTIs can cause symptoms such as pain or burning during urination, frequent urge to urinate, cloudy or strong smelling urine. Fortunately, there are several steps that healthcare providers can take to reduce the risk of UTI in patients with urinary catheters, including urinary catheters should only be used when necessary, so they should be removed as soon as possible. Urinary catheters should be inserted using aseptic technique to minimize the risk of introducing bacteria into the urinary tract. The urinary catheter should be regularly monitored. Sorry. Should be regularly monitored and assessed for proper function and comfort. Maintenance and care of the catheter is important to make sure the bags are emptied and cleaned and changed regularly to prevent accumulation of bacteria. And most importantly, hand hygiene should be performed before and after catheter insertion and care, as well as before and after caring for the patient to reduce the risk of spreading infections. Preventing urinary tract infections in patients with urinary catheter is important for several reasons, including improving patient comfort and quality of life, reducing the risk of serious complications such as sepsis or kidney damage, decreasing healthcare costs associated and treatment and management of UTIs. In conclusion, the importance of Sentinel events lies in their ability to highlight areas of weakness in the hospital systems, processes, and procedures. By investigating these events, hospitals can identify opportunities for improvement and make changes to prevent similar incidents from happening in the future. Sentinel events serve as a catalyst for quality improvement and patient safety efforts, helping to ensure that patients receive safe and effective care. In these instances that I discussed about, preventing infections and making sure the patient's medications are provided safely are all important factors for preventing Sentinel events. They also serve as a reminder of importance of ongoing monitoring and assessment of systems and process in the hospital, as well as the need for ongoing education and training for staff. Overall, the importance of Sentinel events lies in their ability to promote patient safety, improve quality, and enhance the overall healthcare delivery system. And here is the last slide, which are my references. Thank you for listening to my short discussion and hope you have a great day.